All right, let's check in with the doctor, Dr. John Hayes. He joins me in studio every Thursday at this time. Dr. John Hayes, for a better experience at the doctor's office, try Dr. John Hayes' new, highly personalized and affordable direct primary care practice. Find out more at drjohnhayesjr.com, drjohnhayesjr.com. Dr. Hayes, good morning.
Hey, Rob, good morning.
Great to see you. Thanks for joining us in studio. And so the topic this week, the biggest health concerns for women in the U.S. Seems fair. We talked about men, and now it's the women's turn.
Yes. So there are some similarities, but there are some significant differences, too. So we might as well start out by talking the similarities are heart disease is number one for both men and women.
Yeah.
There's a multitude of causes, but the vast majority of causes outside of genetics are lifestyle. I mean, like it or not, it's just the way that it is. Diet, obesity, lack of exercise, habits like excess alcohol, cigarette smoking, etc., probably lead the changeable causes more than anything else. Mm-hmm. No question at all.
Okay, so heart disease, just like men, it's a big concern with women as well. And the same types of risk factors?
Well, pretty much, although there are some differences between men and women genetically. There are some differences in how hormones may affect things like lipid levels and that type of thing as well. Mm-hmm. And it also stages of life are different for women than they are at men. In other words, postmenopausal risks for women are sometimes higher than premenopausal for things like heart disease and so on.
Yeah, because it seems like, for most of the time, it'd just be you'd hear about men, getting heart attacks and having blocked arteries and stuff. The same thing can happen in women?
It can. It can. Sometimes later at a later age and a later stage. But, I guess the biggest takeaway from all this, Rob, is the most important thing is to have some ongoing surveillance of what is going on. I'm still a huge fan of annual labs, periodic EKGs and that type of thing. Makes a big, big difference. It's not always happening, but it's, in my opinion, crucial.
Mm. Okay, up next, we're going to talk about, the big one, cancers.
Right. Yeah. So in women, it's breast cancer is the number one concern. In men, like we talked about last time, it's prostate cancer.
Yeah.
But with breast cancer, there's a number of factors. Genetics is one. Genetics is the discussion you should have with your physician regarding your family health, family history, and so on. Does genetic testing make sense for you? Mm-hmm. If so, then you need to just go down that path very carefully. But also recognize that so much of, again, cancers, development of cancers, and so on is lifestyle and diet related. Very, very important that we stress that and help patients understand it as much as we possibly can.
All right, so early detection is key. We know stories as well where you'll have like your mom or your sister may have had breast cancer, and so that would obviously be something you'd need to seriously pay attention to.
It is, and with breast cancer, there's a lot of things that have changed. Mammography is still recommended, although in medical circles that's debated. For women at high risk, we probably should be doing MRIs rather than mammograms. That's another issue. Complementing mammograms with breast ultrasound is often extremely helpful. Examinations, so the whole self-examination thing kind of went out as a recommendation, but I kind of disagree with that.
Okay.
I think nobody knows your body better than yourself. So if you sense something in a breast examination that's just not right, bring it to a doctor's attention immediately and just get followed up.
Yeah.
It's so easy to get initial diagnostic testing. It's just ridiculous to prolong it. So
let's see, other types of cancer. You mentioned lung and gynecological.
Yeah, so lung cancer, pretty straightforward. Cigarette smoking, cigarette exposure, environmental exposure, just like in men. And GYN cancers are a big, big issue, and they really cross the age spectrum, too. We see women with cervical cancer sometimes at younger ages. Uterine cancers are older, oftentimes postmenopausal, but that onset of uterine cancer later in life may also correspond with other changes, such as significant gain in weight, changes in hormones through menopause and then postmenopause and so on. And then also there's genetic factors as well. And so the big thing really remains screening. And again, this is something I don't always agree with the standard way, so to speak, saying that, well, if you're over this age, you don't need to have an annual PAP. I mean, I will tell you that when I studied in family medicine residency and I worked with gynecological cancer experts in GYN, I asked point blank, I said, is it still a good idea for women to have a pap smear annually? And the answer point blank was yes. And the reason I asked that is the number of women that I was seeing still coming in with cancer. That if we were doing pap smears every year, could we have prevented some of these cases? So that's another whole rabbit hole, so to speak. But again, the most important thing is you've got to have regular follow-up. No question at all.
Let's see, reproductive health.
Yeah, so the big things here, endometriosis, PCOS, polycystic ovarian syndrome. PCOS is more common than we ever thought. It has some connection with diabetes, type 2 diabetes in particular, how we handle blood sugars and so on. There's some genetic correlation there for sure. But PCOS can place women at higher risk for developing other GYN problems and cancers down the road. So it's something that we need to be very, very aware of. And as physicians we are, but we need to make sure patients are aware. PCOS can oftentimes be managed the same way that we help manage type 2 diabetes, which in addition to dietary control sometimes can include the use of medications like metformin and so on. So something to certainly, if you're aware of it or think you've got concern over, to, number one, get an inaccurate diagnosis, and number two, make sure you're getting consistent follow-up and care.
Mm-hmm. We're also talking about mental health, which is extremely important.
Absolutely. And again, women are different than men in terms of hormones. Let's just face it. It's just the way that it is. Mm-hmm. And having those hormonal differences predisposes us towards having different types of issues. There's no question at all. And the reality is that oftentimes it's women are more honest and open about getting help up front than men are. And so that's a big advantage. The thing we need to do is to create a safe environment for both men and women so they get not only the ability to speak up properly, but also the access to mental health that they need ASAP. Crucial.
All right. Osteoporosis. Yeah, we always hear about, sometimes with susceptible to the bones, and we hear about falling and other issues as well. And so that can be really key. It seems like I do hear about this a lot. Right.
So there's two concerns, Rob. One's called osteopenia, which is a decreasing in bone density, and the other is osteoporosis, which is a loss of bone density, both of which can place us at a high risk of fracture. Now, it does happen in men, but more so in women, especially women of smaller stature. Mm-hmm. So one of the easiest ways to screen for this is to do, in addition to screening blood work to make sure there's no significant kidney or thyroid or pituitary abnormalities, is doing what's called a DEXA scan or bone density study. This is another area where I think traditional healthcare has kind of fallen down. There are many women that would benefit from having a DEXA scan every year as we're following through, but your insurance says, oh, no, we're not going to do that. We're not going to let you get that. Yep. Unless it's 2 years out. Oh. So I tell women all the time, well, I can get you a self-paid DEXA scan for under $100. Would you do it? And the answer is yes.
Yeah, absolutely.
Exactly. So I would say work with a physician that understands this and has your best interest in mind.
Okay. Let's see. We have about a minute or so, Doctor. Is there any other ones that I know you wanted to focus on?
Yeah. I mean, the biggest ones, I think, Rob, on this list, and again, I'd encourage everybody to go and read the article, but autoimmune disease. We see this more in women than men, hands down. I'm not sure exactly why it is, but things like rheumatoid arthritis is the big one up there. Also, lupus and so on.
Really?
Yeah,
okay.
A multitude of variations in this. But yeah, women are at higher risk, and they need to be made aware of this.
All right. So, again, talk to your doctor. Be sure with a lot of these issues that you do the screenings and the other tests that you need to do sooner rather than later. And as you said, to listen to your body. You can read Dr. John Hayes' full blog, by the way, if you want to see the biggest health concerns for women in the U.S. Check it out. And you can read it at drjohnhayesjr.com. You can call him and his team at his office, 781-659-7989, 781-659-7989. You can call or text that number. And again, go to drjohnhayesjr.com. Dr. John Hayes Jr. is with us every Thursday at this time on WATD. Thank you, Doctor.
Thanks, Rob.